early days we had no paper, pencil, slate, nothing like that. So the only way children could be taught learning was to collect sand and spread it on the floor. The fingers we used to write. Nobody had become a doctor in my village or in my community also at that time. Doctor is something very, very high up. I remember vividly when I must have been hardly 4 or 5 years old. Next door to house away, I heard a shouting and yelling in the early morning, and I was told that the pregnant woman during delivery died. That lady must have been hardly about 20 years old at that time, and that upsets me. A young woman, hardly 20 years old, suddenly dying away, and you don't see her anymore. And I said, can you not do something to prevent it?
Dr. V entered medical school with plans to become an obstetrician. In 1944, he joined the army as a medical officer. Four years later, he was discharged after contracting a rare form of rheumatoid arthritis, a condition that left his fingers permanently crippled, barring him from a career in obstetrics.
That is how I got into the eye hospital, sheer accident. And even after joining the eye hospital, walking a few steps was difficult, painful. Holding a pen was difficult, and holding surgery was little difficult. It took some years for me to pick up surgery.
Dr. V went on to personally perform more than 100,000 successful eye surgeries.
See, when I started the eye camps in 1961, the government wanted us to reach the villages. The leaders in the community also saw this one, and they were thrilled. And they said, we will come and help you also. So it became a sort of people's movement. In our early days, Gandhiji was all in all for us. His simple life, his truthfulness, and he said spiritual life, progress can be made in the life, not going to a monastery or going to an ashram.
During his years of government service, Dr. V met Sir John Wilson, a blind man of great vision and founder of the Royal Commonwealth Society for the Blind.
In my life, I think he did a lot of work to mentor me. He used to pull me up constantly. Come and we will go and see the Prime Minister, or we will go and see this WHO meeting, something like that. He used to call me up. He will take me, he will say, I will show you around. Blind man shows the sighted man around.
With his help, a centre was set up that drastically reduced childhood blindness due to nutritional deficiencies. The two men also launched a nationwide eye camp program that took hundreds of mobile medical units right to the doorstep of the blind. In 1976, Dr. V retired from government service at the mandatory retirement age of 58. He then started a non-profit trust with his brothers and sisters, and in the same year, an eye clinic was opened in Madurai. It had 11 beds and was called Aravind, after Sri Aurobindo.
When Dr. V started, sometimes I have sort of joked that he started with the finest group of ophthalmologists in India.
What Dr. V used to say is, get less, do more number. That was our slogan.
Sometimes I had to pledge the gold jewelry for the family and get money, because I had to pay to the laborers every Saturday. So like that, in the beginning we had a lot of problems because of finance.
So I agreed to mortgage my house, and then we borrowed about 200,000 rupees or something like that. Then we are gradually building that new building which you see now. When we finished the ground floor, we occupied the ground floor, and we could keep the patients there, operate there. Then we built the first floor. So as we earned more and more money, we added more floors.
Cataract. The clouding of the eye's lens is the leading cause of blindness in the developing world. While a simple operation can restore sight, access to treatment can be difficult. Perhaps no one understood this better than a man known to many as Dr. V.
Dr. V was dedicated to the proposition that he had to reach out into the villages. And if there's anyone in the world who really understood the core necessities of social marketing, I think before the term was invented, he was the person.
See, McDonald's concept is simple. They feel they can train people all over the world, irrespective of different religions, different culture, different all those things, to produce a product in the same way and deliver it in the same manner in hundreds of places. Supposing I am able to produce eye care techniques, methods and all those things in the same way and make it available in every corner of the world, the problem of blindness is gone.
There are now 5 Aravind Eye hospitals in South India. They are all self-sustaining, and together they see over 1.4 million patients and perform over 200,000 sight-restoring surgeries each year. 2/3 of its services are free. All the Aravind Eye hospitals have free and paying sections. Patients decide where they want to be treated. While choice of accommodation varies between the 2 sections, the quality of treatment does not. At Aravind, every patient who can pay covers costs for 2 who cannot. Because of their high numbers, the revenue from paying patients not only covers costs for Aravind's free services, but also generates a surplus that funds all growth and expansion.
And I don't insist upon that man must pay me before I do anything for him. I said, give the sight man, let him give whatever he can give. If he cannot afford, doesn't matter, he can give later.
All the hospitals send medical teams into the villages. Patients requiring surgery are brought back to the base hospital, where they receive food, lodging, treatment, and return transport completely free of charge. Close to 50% of all the patients Aravind treats are sought out and brought back to the hospital through these screening eye camps.
So the typical problems that a patient has is, how do I get to the hospital? Someone has to come with me. It's going to cost me a lot of money. Other person doesn't want to come because he can't take the time off. So all of these barriers are taken care of. Over the years, we built up a huge network of community organizations that support us. And now each year, we organize 1,500 screening eye camps, which translates to roughly 30 to 40 screening camps every week. In our system, we operate each day between 600 to 1,000 patients. And we need to do that for us to remain efficient, and the whole systems are geared around doing that, and this doesn't happen accidentally.
Dr. V said administration is essential. And 2 of the qualities that he brought to the Aravind model were the necessity of good administration and a conviction that systems could substitute for a richness in available human resources.
That means no step in the process of treating patients is too small to be analyzed and put to maximum use.
You can see just how busy this intake area is, and to help manage the flow, Aravind has even this down to a science. This calendar is based on the last 3 years of walk-in patient data. So for every single day, they know exactly how many patients to expect.
Not only has Aravind invested in the best surgical technology, but also in technology outside the operating room to help doctors keep patients moving.
You must have seen all those the monitors in the doctors' cubicles. So we also want them to be aware what is happening, how many patients are waiting outside, and how many patients have been seen. When the patient walks in, you should be seen within 90 minutes. So that is our benchmark. So we would like to see how many patients are seen. If that information reaches the doctor who's inside a cubicle, he is not seeing what is happening outside. That motivates them to do a better job. Here we have maximized the productivity of both the doctors, nurses, and also the equipment. So that brings down the fixed cost on any procedure, on any treatment. So at least we have 6 nurses to support 1 doctor, which means that 1 doctor is able to do about 8 to 10 surgeries per hour.
With around 2,000 operations per year, Aravind surgeons are among the most productive in the world.
Comparison of Aravind's productivity against the national health system of the United Kingdom. They do around 500,000 surgeries, eye surgeries, a year. Aravind's does around 300,000. So you've got a single organization in the developing world doing close to 60% of the volume of the United Kingdom in eye care. And then you look at the cost comparisons. How much does it cost the United Kingdom to provide that care? It costs them £1.6 billion. It costs Aravind less than 1% of that. So you've got a high volume, low cost system. And then the first thing that creeps into people's heads here as well, that means quality must be taking a hit somewhere. They've done fairly recent studies that compare complication rates at Aravind with the Royal College of Ophthalmology, again in the United Kingdom. They studied the complication rates across 20 different types of complications. Aravind's quality outcomes were found to match and in many cases exceed that of its Western counterpart.
Almost every step of the way, Aravind patients are accompanied by young women workers. From the waiting room, through the exams, to the recovery rooms. This rainbow army, Aravind calls them MLOPs for mid-level ophthalmic professionals, is color-coded by duty.
They had so much of respect to the patient and they were willing to do any type of work for the patient. And they were also willing to share with us in the dream of the hospital. That is how our program started. So from 1976 onwards till today, every year we take about 100 girls from the village.
They're trained on the Aravind campus, and they live here in a communal dorm. Drawn from local villages, they're a familiar and reassuring presence.
They are like the pillars of Aravind. The children who come from the agricultural families, they know what hard work is. They don't mind working hard. All of us work hard. It may be like 8-9 hours of work, like any other place, but here it is every minute. There is no kind of time for you to relax.
The salaries many of these women earn at Aravind help support their families back in the village or fund additional education. Further evidence of Aravind's impact not only on its patients, but on the larger community. This is Arolab, Aravind's own lens factory, first launched in the early 90s when Aravind had hit a wall. It couldn't afford to continue to expand the number of free and subsidized surgeries because the cost of a replacement lens had gotten too high, about $100. But by cutting out the middleman and other expenses, Arolab is able to sell them for a fraction of that, about $2, and still make money.
So when Aravind built this place, the idea was just to serve their own needs, but what they ended up doing was changing the global marketplace.
So our mission is not just eliminating needless blindness in our service area, but across the whole India and also in the whole world.
Arolab not only supplies the Aravind hospitals, it accounts for nearly 8% of the global lens market, exporting lenses and other medical products to 130 countries, mostly in the developing world.
Throughout the time that I've spent with Dr. V, his vision of what was possible was way beyond what was anything reasonable.
I first met Dr. Venkateswamy in 1978 when he came to Michigan, and I was working at that time at the University of Michigan Medical School. When Dr. Venkateswamy came to meet me out of his interest in continuing education, he remarked that he would someday like to have a center like this one. And in the back of my mind, I was thinking, now wait a minute. He has an 11-bed eye clinic in India. He's coming to the States and walking around this 40,000 square foot facility saying he wants one just like this. How is he ever going to do it? And in a matter of years, in around 18 years, he had done it and established the Lions Aravind Institute for Community Ophthalmology.
This institute helps transfer the Aravind model to other eye care programs in India and the rest of the developing world.
It set itself originally a goal of working with 100 hospitals through the international NGO partners, and then try to help each one of them to do maybe 5,000 or more surgeries per year with good quality and a sustainable manner.
Now this is a good model from Malawi. Malawi, we have been working with them. Before going there, they were able to do about 440 surgeries in a year, 449 in the whole of 98. As a result of the interaction like that one, now they are able to do that number in 1 month.
Today we are working with 150 hospitals, and many are doing far beyond the 5,000 that we set, and they're touching 10,000, 12,000. Some are becoming role models very much like what Aravind is in this part of the country, and we're using them to propagate this message even further.
And I think that's something else Dr. V has taught me, that the way you make things work the best is you don't hold on to it and say this is all mine and I'm in control of it, but you give it away, which is what he does.
When we grow in spiritual consciousness, we identify ourselves with all that is in the world. So there is no exploitation. It is ourselves we are helping. It is ourselves we are healing.